The aim of the PIS5 STORM trial is to assess for patients with oligorecurrent nodal prostate cancer located in the pelvis the best treatment strategy that we can adopt for these patients. So the study randomized patients with up to 5 nodal lesions as detected by PET-CT, mainly PSMA in this case. More than 80% were restaged with PSMA. Is to randomize patients between an MDT strategy, so it means salvage lymph node dissection or focal SBRT to the node, delivering 30 gray in 3 fractions, versus the same paradigm, so salvage lymph node dissection plus an elective nodal irradiation of the whole pelvis, or an elective nodal irradiation including a focal boost to the nodes. Both arms are treated with 6 months of androgen deprivation combined with this treatment. During the ESTRO meeting, we presented the first acute toxicity data comparing the 2 modalities. And what we observe is that the treatments, both arms, show very good toxicity profiles with no or very limited grade 2 or more toxicities, and compare the arm A, so the MDT strategy versus the elective nodal irradiation. There were no statistically significant differences in terms of GU and GI toxicities. So, of course, the next steps will be to assess the long-term toxicity and the outcome of these patients, so to assess if a more comprehensive radiation can achieve a better or equal, eventually, disease-free survival compared to the MDT strategy. And, of course, in terms of toxicity, we will assess as well the impact on the quality of life during the acute and the long-term period.